The Plan, Do, Study, Act cycle, or known as Pdsa, is the selected model to implement changes of improvement. This is a simple and powerful tool for accelerating quality improvement. Shown here is the Pdsa worksheet identifying the plan and the do of the cycle. The stated objective is that in the next 6 months, nursing and radiology departments will enhance patient safety by identifying vital transport information with the use of SBAR tool and transport process that includes high reliability, prevention of error, and staff accountability. Since there is no data collected prior to the incident, starting baseline for this project would be 1 safety event to 0 occurrence of transport-related event. Our proposed plans or test of changes are the following. Number 1, nursing pre-assessment. The goal here is to ensure that nurses perform an assessment that includes vital signs on patients. This is done within 30 minutes prior to transport. With the nurse's critical thinking and judgment, nurse will identify the need to accompany the patient to the procedure area. The information collected in the assessment will be reported to the radiology department prior to transport pickup. Number 2, SBAR tool. The tool is developed within the new policy and will be used by the transporter to receive handoff from primary nurses. This tool will also guide the transport to perform equipment checks used for the patient during transport. Who is responsible for the implementation? Frontline staff that includes nurses, radiology technicians, transporters, and leaders such as unit managers and directors, risk and quality department leads will be the task force who will carry out the plans and actions. When? The timeline to meet the aim of this project is 6 months. However, to carry out the test of changes, this will be done in 4 months. This will give the team enough time to study the results of the test of changes and create changes when needed. What are the action plans? Action plan includes conduction of mandatory meetings to socialize and introduce the new policy developed during the root cause analysis. Develop a validation or competency checklist for nursing, radiology, and transporters. Conduct staff training that includes the key components of the plan, which is the nursing pre-assessment and the utilization of the SBAR tool. Real-time validation and observation of the transport process with real-time coaching will be provided by the members of the task force. Data will also be collected through electronic health record and submitted completed SBAR tool. Task force will also review submitted occurrence report or incident reports revolving patient transfers. The action plans have been carried out. After the action plans have been carried out, the expected outcome will be 100% of all transported events will have nursing pre-assessment 30 minutes prior to transport. 100% of all transported patients will have completed pre- and post-transport flow sheet. 100% of transported patients will have completed SBAR tool by transport technicians and radiology technicians, and 0 incident reports regarding transports. Staff engagement, verbalization of transport process, observation of peer-to-peer feedbacks and coaching moments, and also soliciting staff input are the measures of assessing the predicted outcomes.